I would say that the definition of health really comes first and foremost from the individual and what they're looking to achieve. I think there is then clearly a scientific component of it that people don't readily understand because they can't see it, touch it, or feel it. And that's the relationship that a provider, a clinical provider, can help them with.
I am visually impaired, but that doesn't mean I'm unhealthy. So disability and health are not necessarily the same.
For me, quality health care is about engagement with the patient on a level that is relaxing and comfortable to them, because my patients are at a different level of readiness than some of the people that are coming into a clinic already knowing that they have health needs.
We're all human beings, and obviously your ability to function in a healthy state, to do your job, to do in all aspects of your life, whether it be with your family first of all, and going to work, and I mean all aspects of that require good health. So in order to be happy with just physically being able to be mobile and do all the normal activities of life, as well as a state of mind about being healthy. So I think all of that leads to a productive life, and if any of that health is impacted, it's going to clearly affect all aspects of your life, going to work or at home or whatever.
To me, being healthy is pretty much everything, like how you eat, how you interact with your day. You are what you eat, pretty much. And if you're not healthy, you can't expect to live a long, happy life.
I think of, because patients often come to us with diseases, I think there's a tendency to reduce health to good management of a particular disease state. But I really think it's much more than that.
Quality in health care is in the eye of the beholder. I think when you're seeking health care, you have certain goals in mind that you, as an individual, want to receive and look for from your provider, be that preventive care or ongoing maintenance of a chronic disease. And so you want the best.
I think the only thing that causes you not to be healthy is yourself. You know, if you're lazy, you know, people use excuses like they're always tired, things like that. That causes you to be unhealthy or eating unhealthy foods like fast food all the time.
For me, it has a component of having a mind that's functioning normally, a body that's not sick, and a spirit that's fulfilled.
With health, it actually is everything for your life. Because without health, it's might well, die, because even if you have $15 billion, you can buy your health.
Well, clearly the health is the most important thing that you have for your quality of life. If you don't have health, you don't really have anything.
Happiness, joy, being able to be on my own, to do for myself, feeling good, full of joy, being able to go places, do things, help other people.
Number one, it's got to have access. People have to be able to get what they need in terms of their health care when they need it, and in some kind of relatively convenient, situation.
If you don't have health insurance, it's isolating.
If you're not feeling good, you're kind of irritable. You can't go anywhere. You can't barely do anything. It kind of confines you, and because I know when I don't feel good, I don't feel like being bothered. So, you get kind of seclusive and you don't feel like being bothered.
It is very sad that someone has to have found a disability first before then they can have health care, Medicaid. So patients that I have that aren't disabled, it's not proper for them to go fishing for a disability so that they can find that they have one, be qualified for a disability, and then be able to get Medicaid because of that. That's very sad to me.
Myself, I haven't been weighed in a number of years because the scales are not equipped for a person with a disability, especially in a wheelchair. Because since I am not able to stand, I have not been weighed properly.
For most people who suffer with common chronic conditions, high blood pressure, diabetes, bad knees, sleep apnea, obesity, high cholesterol, the most important medicines for each of those conditions are not anything I write on a prescription pad. They're how we eat and how much we move. And the limitations for people in their ability to adapt and make changes that can help them become the healthiest, even if they are highly motivated to do so, are limited in ways they often don't even see.
The barriers that I have encountered in the very beginning was not enough information and not enough people caring, giving you short answers, not taking time with you to educate you, to find out that, oh, just give her a few minutes to tell her some of the things that she really needs to watch out for.
They don't know, in the clients that I see, I feel that they don't know what is out there. And if they don't know what's out there, they don't know where to go to get healthy, to contact people to help them be healthy. And it's frustrating. So when they're frustrated, they're deterred from trying to seek help.
像我这样移民过来的，就是说看病最难，又花那么多钱，又看不起，是这样的。
Being healthy is the best things that, for example, I'm an immigrant right here, so if I really get sick, I'm really worried about I need to spend money to see a doctor, I need to find a facility to see a doctor, so basically from my perspective, being healthy is the best thing for me.
We need a healthcare system where nobody has to struggle to pay their bills. A woman with breast cancer in this country is 40% more likely to die if she doesn't have insurance than if she does. That's unacceptable. No one, everyone and every family that's afflicted with a serious illness should be relieved of the burden of finding out, of struggle and finding a way to pay for it.
Right now I have bills coming in the mail because my insurance doesn't cover everything, you know, and that's a worry for you. I can't afford these bills that are coming in the mail. I have to make arrangements to pay these bills, and that's stressful. And when I don't have to stress about that, that will help some with my health issues, you know, because I'm always tensing up, you know, what's in the mailbox every day. So, and I'm sure I'm not the only person in the world that has that problem.
Quality health care, let me see. I'm not sure how to answer that.
Quality health care is identifiable by lots of things, but we don't have good precise measures of quality health care.
The definition of excellent care, what it is to truly give high quality care, doesn't change depending on your financial situation or your social situation. That there's a single standard that we need to live up to with every patient who comes in.
And we should not be arguing as a country about whether or not everybody has the right to health care.
The quality of care in Canada, Mexico, and Honduras is superb compared to the care that one often gets here. The technology that they have in Mexico and Honduras is not as highly developed as it is here, the medical technology. But I'm growing more and more feeling that the care part of it is of equivalent value to the cure part.
We as people in all walks of life in all different places, we receive services. Sometimes we pay for the services as part of our everyday lives. Sometimes they're private sector services, sometimes they're public sector services. We have different experiences in those contexts as customers.
This coordination across systems of care, I think, will be made easier by the health information technology and enable us to treat people more personally and more cost-effectively than we've been able to do before this technology was available.
Say that I don't believe I've ever had a totally positive experience with healthcare being visually impaired.
I know I have quality health care when I don't worry about it. It's a constant worry for me because I'm always in pain.
Public health or population health is critical for a community to be able to function at its highest levels as well in a cooperative and collaborative sense.
Not forgetting that important aspect of mental health. How can I feel connected to others? And likewise, you know, if we draw back and think not just about me personally, but how can everyone here in the city of Cleveland feel safe, connected, healthy.
I think we can all watch out for each other. We can all help each other to do better, healthier things. We can all enhance each other's quality of life, sometimes through the simplest of things, sometimes just through caring about one another. I think it's a never-ending search and desire to have the best possible life.